So women can go on TRT?
Yeah, actually, a lot of the symptoms women get from menopause, the weight gain, the fatigue, the mood changes, actually from suboptimal testosterone levels more than is estrogen.
Does women have testosterone in them naturally?
They do, at a much lower level than males, but they do still have it. And a lot of times it's the gaps between testosterone and estrogen that causes a lot of the mood issues. It causes a lot of the weight issues. So I always tell women, I could probably get rid of 90% of the issues you're having due to menopause, just a little testosterone. You start them on it, they feel great.
But I was given vaccinations as a kid. My kids have none right now, but it's because we're worried, right? Like what's good, what's bad? Like what are the ones you really believe in and you could put some...
Nowadays, if you look, you're getting a ridiculous amount of vaccines, 100% true. Back, when you and I were kids,
What's your real thoughts on TRT and who should be on it?
So I think everybody should be on TRT. I like to explain hormone replacement, kind of like a car. In males, if you have low testosterone, that's like taking your car, parking in the driveway, don't start it for a year. Your car is not gonna last that long. Things are gonna go wrong, things are gonna rust, things are gonna break down. Same thing, low testosterone. You get low testosterone, you start to develop blood pressure, cholesterol. Low testosterone is a risk factor for prostate cancer. So your body is like a car, it starts to break down a little bit.
They say the opposite, you take it, you have high prostate cancer.
If you abuse it. Now you get to bodybuilder levels, 2,000, 2,500, stuff like that.
Take your car. 750 or 1,000.
No, that's taking your car, driving it 100 miles an hour every day, beating the hell out of it. That car's not gonna last. Same thing with the body, you're gonna develop all the problems. Your car is gonna last when you're driving 55, 60 down a nice smooth road. That's a testosterone level of 800 to 1,200, right in that sweet spot.
Dude, we all have the best time ever to start a small business.
If I'm not gonna be 100% in, I'm not gonna do it.
Come on, man, just be yourself.
Yeah,
and just show up as yourself.
If you don't realize what I'm really about, I'm about freedom, family, and
Dr.
my
Mike,
country.
Cheers. Welcome
Cheers.
to the, you got water in there, you're a healthy doctor.
Yeah, it's watered down now.
Long Island guy, my wife is from Long Island.
Now Jersey guy, transplanted over here.
I mean, what's better, be honest? I mean, you grew up there, so it's tough, but.
I always had my roots there, but I like Jersey more. There's more space, it's not as crowded. Yeah, Long Island just sucks. It's gonna take you 45 minutes to get down the block, so I'll take this any day.
It's getting more crowded too, Jersey though.
Yeah, everybody from New York is coming to New Jersey now, so now we gotta find the next good place to go.
And they got Netflix coming into Monmouth County, which is
That's gonna blow everything up as soon as they build that up.
It's gonna jack up our businesses, our houses, which I'll take.
Everyone's business should, business, real estate, got an Airbnb, it's all gonna take off once
Ripple
that comes
effect.
in.
They're definitely coming to see you. They wanna look good, hair transplant, some TRT.
Look good, they gotta feel good, they gotta stay on top of their game too.
Yeah, and that's why you're staying on top of your game.
Absolutely.
So I met you. I met you through Jamie with Eat Clean Bro. I was like, hey Jamie, where do you blood dump? Because I having problems finding it. I got on TRT. He's like, I'll go see my boy Mike in Tinton Falls, which is close, right off the Parkway for me. And we just hit it off. I'm like, dude, you should come on the podcast, talk about your story. So for those of you who are going to watch, because you know Dr. Mike or your friends and you know him, this story is based on turning around and helping the next guy or girl in line.
Absolutely.
Just being a real dude. Entrepreneurialism is very hard. It's lonely at times. You doubt yourself at times. And if someone else can tell their story and you're looking to get in the same field as Dr. Mike, he could be an inspiration and some education for you. So that's why you're here, man. Thank you for coming.
Yeah, appreciate you having me. Yeah, if I could help anybody, just inspiration, guidance, that to me, that's the biggest benefit I have. I've learned made my mistakes. If I could help somebody avoid mistakes or get through a tough time, to me, that's just as rewarding as, a successful business.
Yeah, you can tell you care.
Absolutely.
You're a good dude. Let's talk about your upbringing. Long Island.
Yeah,
Massapequa,
born and raised in Long Island. I lived there until I went away to college. Grew up in the same house. I have a sister 6 years younger than me. It's me, my parents, my sister. Played lacrosse through high school, went to college. Funny enough, I actually ended up almost failing out of my first college. I went to New York Institute of Technology first. Definitely 18-year-old, not ready for college, just ready to party. So went to maybe, 3 or 4 classes, showed up for tests here and there. Went to go make my schedule for the following semester, and I remember the advisor asking me, don't you think you'd be happier at a different school? Why don't you go look at someplace else? Basically their way of saying,
you suck.
Get out of here. Yeah, get out of here. Went to a state school for like a year and a half, 2 years, got all my stuff together, And then I ended up going to Penn State for 2 years, and that's where I finished my undergrad. I got introduced to a physical therapist along the way who introduced me to the world of orthopedics. So while I was at Penn State, I thought, maybe I'd go into orthopedic surgery, something like that. Really didn't have a great direction at that point, but applied, went to med school, got into med school at Virginia Tech, did my 4 years there. Stepped out of med school, did my residency at St. Michael's Medical Center in New Jersey. So that's what brought me from Long Island to New Jersey, was my residency. Finished there, almost went into a cardiology fellowship, which would have took another 4 or 5 years of my life worth of training. But decided, I know I'm not going to stay in clinical medicine forever. I know I want to go and open something, I want to do something different. So ended up working in a hospital. So I finished my residency in June of 2018, started working in the hospital right away. Quickly saw that the hospital, it's a very political place. There's a lot of, taking care of the administrators, taking care of the insurances, and not really able to do right by your patients. I always explain it. It's like you come to the hospital, you put a bandage on it, you put some medicine in it, I'll see you next time. You're not actually curing or solving anything, which is something that bothered me. Part of it too, you don't have your time with your patients. I like to sit and take time and teach people what's going on. If you know what's going on with your body, if I could explain it to you, you're gonna own that. You're gonna do what you have to do to correct that because you know what's going on instead of just, my doctor told me I have to do this.
And you got to build rapport for people to actually, like if I go into a doctor's office, I run high blood pressure. We were talking about this earlier. And I knew they're automatically going to say med. So I'm not going to tell them that right away. I'm actually get to know me, get to know other things that I have going on. And there's no time.
Yeah.
Next patient, next patient, next patient.
Exactly, that's medicine. Throw some medicine at it. It's, patch the problem and on to the next person. So never felt right doing that. And then I got sick of working in New Jersey just because of how demanding it was, seeing 20, 30 patients a day and not being able to do good patient care. Ended up flying out to South Dakota for 6 months. I was working out there. Different world out there. You see 5, 10 patients a day. They're well staffed. Everybody respects you. That was great. But at that time, it started to get a little bit tough. My daughter was 2, 3 years old at the time. Back at home. So she was starting to notice that I was gone. Where's Daddy? Or FaceTime with her. When are you coming home? So that kind of started to get to me a little bit. And then a wonderful thing called COVID hit, and they told me to stop flying out to South Dakota. I'll never forget, I was actually in South Dakota the day that they closed everything up here. And I was actually sick. So oddly enough, I was in Manhattan with my parents seeing a show that same weekend that they said that guy from upstate New York was there, that first person to carry COVID on the East Coast. So I get out to South Dakota and I just start feeling like crap. I'm kind of sweaty, I'm short of breath, I'm walking up 1 or 2 steps and having a hard time breathing. So I send myself to the emergency room, I got a CAT scan. I'm thinking, I've been flying back and forth across the country a bunch of times a month. And I'm worried, do I have a blood clot in my lung? Do I have something going on? So I get a scan, the radiologist calls, no, no blood clots, you just had pneumonia. At that point, I'm 31, 32, I'm I'm 30 years old. How do I have pneumonia at 30 years old? Well, fast forward 3 or 4 days, I'm sitting there sweating with fever, coughing my brains out. Back here in New Jersey, they shut everything down. So next day, I'm flying back to New Jersey. The thought in my head is, oh shit, I have COVID. I get on the plane, there are 2 people on the plane besides me, and then the stewardess. Eeriest plane ride I've ever been on.
Yeah, you definitely infected them.
Yeah, I was definitely patient zero going from South Dakota, Minnesota, back to New Jersey. Fun to get back to New Jersey, get tested. Guess what? I had COVID. So it sucked the first time around, but
so doctor care in South Dakota sucks. Is what you're saying?
Yeah, it's different. It's more. You actually have to focus on the patient in South Dakota. So it was great patient care, but when you're out there, it's you're in the middle of nowhere. You got nothing to do. So
yeah.
But yeah, then I was working back here in the hospitals during COVID and just got fed up. Honestly, we were sitting in the hospitals. We would come in every morning and be like, well, 20, 25% of our patients died yesterday. What are we going to try today? We didn't know what we're doing. Maybe we'll try this. We'll try that. It was a guessing game each day.
Isn't that scary?
It's scary, especially because I'm thinking about it, I'm here. I'm in the room with these people. What if I get it? Mm-hmm. The weeks I was working, I was actually staying in a hotel room because I didn't want to bring something home to my daughter, to my wife at the time. I was like, I don't want to get them sick. I'd rather stay in a hotel if I get sick.
What were the people dying? What were their ages?
All ages. Oddly enough, it was, I saw people my age dying, I saw older people dying. But I think
why were people your age dying?
I think it was a lot of people, before COVID, they took what they considered minor things for granted. Oh, I have blood pressure, I'll take a pill. Oh, my cholesterol's a little high, I'll take a pill. But those are the people who are getting severely infected and were the ones passing away. So I think that's
So if
really
you had
what
high blood pressure, you could die from COVID.
I think it was just a risk factor. It made you more susceptible because your body's already at a compromised state, so you might have been more susceptible to it.
But they took the black check off of blood pressure. It doesn't kill you no more.
That's what I say. Yeah, blood pressure alone, but does it make you more susceptible to other things?
Mm-hmm.
Or is there a genetic predisposition where now you're more predisposed to have high blood pressure and other things? Maybe.
So what did you think about vaccines at the time?
I didn't love the vaccines at the time, especially the mRNA vaccine. If you read into that technology, that was technology
Did
abandoned.
you have to take it? Were you still in the hospital?
No, I got out of the hospital before they mandated it, luckily.
Yeah.
But the mRNA vaccine, it was an abandoned technology back in the 80s. And now they bring it back during a global pandemic.
I mean, the guy was screaming like, this is not for it who invented it.
Yeah, exactly. I mean, we have vaccines that work, that we know work. We know the side effects. Why not use that?
What vaccines do you think work?
Yeah, like when you have the inactivated viruses, or you give the DNA strand where your body can mount the response, but you don't have the technology where it reverses into the cell.
You're talking Dr. Mike Smart. let's relate it to like the mom out there that's worried about their kid. Because first of all, I'm not anti-vax. I definitely didn't take any of that shit. But I was given vaccinations as a kid. My kids have none right now, but that's because we're worried, right? Like what's good, what's bad? Like what are the ones you really believe in and you could put some, because you're an outside the box doctor. You don't like do traditional med.
Absolutely. I mean, nowadays, if you look nowadays, you're getting a ridiculous amount of vaccines, 100% true. Back, when you and I were kids,
20?
Maybe if that many. But, it was the serious things. So it was your hepatitis, it was your polio, it was your things that could actually kill you.
Yeah, they were going on.
Now you're giving, flu. Yeah, if you're older, if you're immunocompromised, yes, flu could kill you, but a lot of times, flu's not going to kill you. So you really just have to see, what's going to kill you, and should I take the vaccine for that? I mean, that's where I think it really is good.
Do you take any vaccines currently?
No, I mean, when I was in the hospital, I was getting my flu shot yearly, but now, I have whatever I had as a kid, and I haven't gotten anything recently. Never took the COVID vaccines, never took any of the other ones, so never took the HPV one, so yeah, just
from a doctor's position, like what are you seeing? Are you reading any of those studies that came out? I try to read them, but like half the shit's like total jargon to me.
I've gotten to the point where I can't even read them anymore because it's all just the same nonsense where you're seeing this come out, you're seeing that come out, which things that we have seen happen, we're now just validating what we have seen. Mm-hmm. And at some point it's like, why do I want to keep reading the same thing that I know that was going on? You're just validating my thoughts. So
what are your thoughts on it though?
The COVID vaccine in general? I think it did more harm than good. I mean, I had COVID once when it first came out. I worked in the hospitals. I never tested positive again for COVID. So what does that tell you? My immune system wasn't any better than anybody else's, but getting the natural immunity is going to be better than the vaccine, where you have people who have gotten how many injections and they're still getting the virus today. Mm-hmm. So it's really, I think, just we had the wrong technology at the time. It's, we went back instead of using the stuff that we know has worked. I mean, you got your hepatitis B vaccine as a kid and you're still immune now. Why not use the same technology that we know has worked?
What's the main drug?
Immunity?
What's the main drug they used at first that was definitely killing people? They used it in Africa. They tested on it. Was it hydrochloroquine?
Hydrochloroquine, yeah, malaria drug, yeah.
Yeah, and it was, it killed like 80% of the people they tested on in Africa.
Yeah, malaria, if you have a high load with malaria and you take the medication, it can have that adverse outcome. So, yeah.
It seemed like it was killing people during COVID that they were putting on shit.
Yeah, I don't know if they've ever actually found the mechanism why, but yeah, it seemed it was people that were hoping that was the cure and they were trying
was that stuff kind of like your reason to rip out, or was just like, I'm not going to make the money I want to make, this is too much restriction?
It was, I'm not doing right by people. Mm-hmm. I remember there was one hospital I was working at where they actually told the doctors, you're too valuable to go into the room. Let the nurses go into the room and call the patients from the call phone and do your rounds that way. At that point, it's like, what am I doing? I'm putting somebody else at risk because I'm too valuable. And I signed up for it. I knew what I was getting into. But, just watching young people die and not being able to do anything about it, it wore on me. I pronounced countless number of people dead. Like, it was a common occurrence, and it wears on you. You kind of become almost immune to death at that point.
What is it like to see like your first person that died?
It was. I will actually never forget. It was my first month of residency. I was on a night rotation on a Saturday night, And the nurse on the floor calls you, oh, you know, so-and-so in this room has passed. We need to come pronounce them. You go in there, you know, I'm 2 weeks into residency. I'm just a doctor.
How old?
I was 31 at the time. Not even, no, I was 29 at the time. Wasn't even 30 yet. And, you know, I go in there, I'm like, I'm looking at a nurse like, what do I do? They don't teach us this in med school. They teach you how to pronounce somebody. She's like, you check for a pulse, you check for a blood pressure, you check for breathing. So I'm checking and I'm examining. I'm like, okay, you know, she goes, all right, what time? I'm like, all right, give her time. Okay, that's the time of death. And it's like, but that's it. She goes, yeah, you got to fill out the death skip, do this. I was like, all right. It's like, you don't realize, like, and then you kind of just become immune to it when you're surrounded by it all day in and day out. So yeah, there's another one. Okay, yep, that one, yep, sign this, sign that.
Yeah, I think that a lot of the conspiracy theorists, and I was definitely somebody who like believes in like challenging the system, so I'd be probably classified as tinfoil hat guy, but there was definitely people that died. My wife was, not my wife, my sister was a nurse in the cardiologist unit in Brick. And, you know, they were putting people on, you know, Ventilator. They were doing this type of like major thing, and people were dying on her floor like left and right. So she was like, hey, like, I'm afraid, this is real. That seemed like where was the point that it like fell off? Like what changed?
I think we learned that, you know, everybody was saying, oh, we need more ventilators.
Yeah, that was the problem.
When you were put on a ventilator, that was essentially a death sentence.
Yeah.
I could probably count on one hand the number of people I saw in the beginning who were put on a ventilator and successfully came off a ventilator. We also learned that you can't put 5, 6 people in a room because that increases their viral load. Higher viral loads cause more mortality.
Okay, so question, like, so what would change? I'm just curious. I'm not trying to like trip you up or anything. I literally like to learn. So when you're putting someone on a ventilator, just in general, like COVID aside, would that put you at a higher risk? Is it because you're punching into a lung or? Yeah,
anytime you're put on a ventilator, you are essentially either you're going in for surgery or you're near death. It increases mortality greatly because it's either you're not able to support your respiratory drive, you're not able to get oxygen, you know, through the lungs into the blood. So there's a reason why, and you're deteriorating pretty rapidly, which is why you put somebody on it. You know, a lot of times the lungs will heal. A lot of times we do it because the lungs need to recover. They need time to relax. So the lungs can heal and they can reverse. During COVID, there was so much inflammation where you weren't able to get the oxygen from in the lung into the bloodstream, and there was no recovering from that. You can't artificially oxygenate the blood without the lungs.
Why did the vent kill him then? I mean, in theory,
we would put somebody on a ventilator, regardless COVID or not, when their oxygen saturation hit a certain percent, whether it was 85, 80, depending on what it was.
What could it have come down to if they didn't go on that? Without them dying without the vent?
It's different for everyone. It's a big lifestyle thing. I've seen smokers who have walked around with a normal oxygen saturation of 85, 87%, where, you know, they could go down to, you know, 75 and they'd be okay, but a normal person who doesn't smoke, they might get down to that 80 and they might be completely obtunded. They might be completely out of it. So it really depends on the person.
Yeah, it was such a wild time, man.
It was.
Now you hear all the stuff coming out, which is all like factual stuff. No one has to be a conspiracy theorist anymore. Like it came from this lab in Wuhan. You know, Fauci and the boys funded it, and the Chinese more or less released it. And you have all this, you know, blood disorder that has come from it, from the vaccines, and you're like, who pays for that? Like, who helps those families recover that their grandma died and they couldn't do a funeral for her? And
no, there's people, they lost people and they never got to say goodbye. They never got to be close to that person again, and it took away a lot of the mourning process.
Yeah,
you know, it's going to affect a lot of people, especially think of the young kids. I mean, you and I have young kids. You know, for the first couple of years of their schooling age, they weren't in school.
Were you here earlier when I talked about traveling?
No, I wasn't.
No, I was talking to Chris and them. So me and my wife, a good friend Chuck and Kelly, they're older. They have kids obviously older than ours. And Kelly and I traveled a lot prior to having kids. And they're like, listen, get your kids on the plane right away. It's great for them and you to adapt. And when we had my son, 6 months later, COVID happened. So my son has still not been on a plane, which is crazy, but shit throws fucking wrenches.
Yeah. And it's what are we going to see with them when they're teenagers and when they're adults? Is it going to affect their development? Kids develop a lot from being around other kids, from life experiences that they missed out on for a year, half a year, 2 years, whatever it may have been.
Yeah, for sure. So that was a wild story. What was the main like ingredient that made you say like, I'm out of this, I'm gonna start my own practice and doing what you're doing today?
I looked at it. It was a couple things. I wasn't able to do right by people, and I was afraid of bringing something home to my daughter. It's like I don't want to put myself at risk, put her at risk. I remember the big thing I did that drove me away. I was getting ready to go to a shift, and the shift before, one of the other doctors I had worked with got COVID and ended up passing away.
Really? How old?
He was in his late 50s, so he's a little
Health
bit older.
issues?
I'm not sure if he had health issues, but blood pressure, the regular stuff that you would, what we call the regular run-of-the-mill
Man,
stuff.
you're bugging me out about blood pressure, man.
Yeah.
I gotta get on meds now.
Yeah, blood pressure, no, you gotta do it without meds. That's the thing. Meds make it worse, it seems.
I like bourbon though.
Yeah, there you go. Yeah, kill a little bit of everything.
My blood pressure goes down when I drink bourbon.
There you go. It reduces the stress a little bit. But I remember before I go, writing down all my important account information, bank accounts, and writing a letter and leaving it in my safe to my daughter, just in case. I remember I was driving up to North Jersey for my shift, like, what the hell am I doing? As that moment, I was like, you know what, this is it. This is my last shift. I'm gonna go figure something out. I had learned how to do the Botox and fillers and stuff from a nurse practitioner who I was friendly with. So I figured, let me go into this field. This seems like a very lucrative field. It gives me a better lifestyle. And there's a lot of opportunity for business when during COVID, if you kind of played your cards the right way. So I started my clinic, building it out in May of 2020. I opened in July. But the big thing was, focus on the health and wellness, focus on the hormone replacement, focus on weight management, focus on doing biohacking, starting to cure things with vitamins, minerals, diet, exercise. The body's an amazing thing. It can heal itself if you give it the resources to do so. So that's what got me into it. And that's also what led me to be able to do what I do now. It's being able to do right by people. So I'm satisfied I'm getting to do right by my patients. I'm able to share my knowledge. I'm able to teach people about what's going on with their body and why they need to do certain things. And I've gotten countless people off of their blood pressure medications with diet, exercise, weight loss, hormones. People who have suffered from anxiety, depression, really helping to reverse that with with hormone treatments and stuff like that. So to me, it's rewarding when I have patients coming in, thanking me for changing things. And I have people come in saying, I haven't been this healthy in years. I haven't felt this good. I had one woman where I started on hormone replacement therapy, and her husband came in 2 weeks later.
What type of hormone replacement therapy for a woman?
And so she was on combined estrogen, testosterone, and progesterone.
So women can go on TRT?
Yeah, actually, a lot of the symptoms women get from menopause, the weight gain, the fatigue, the mood changes, actually from suboptimal testosterone levels more than estrogen.
Does women have testosterone in them naturally?
They do, at a much lower level than males, but they do still have it. And a lot of times it's the gaps between testosterone and estrogen that causes a lot of the mood issues. It causes a lot of the weight issues. So I always tell women, I could probably get rid of 90% of the issues you're having due to menopause, just a little testosterone. You start them on, they feel great. And
does it also make them horny?
It does. Same thing it does for males. Sex drive, muscles, feeling well, recovery.
We gotta get my wife on tests.
Yeah, I gotta tell you, I got a lot of women who come in who get on tests, and the exact story. Men are coming in a couple weeks later. I can't keep up anymore. Whatever you did, I need that too.
I have no problem. I'm not busting chops with my wife. I have no problem in that department. But that's interesting. I mean, there's a lot of women that struggle with that, and they see the moodiness, and there's definitely some people I'm thinking in my head you should talk to, but I won't say their names. Like the craziest thing about testosterone replacement therapy, so TRT, it's SIP, which is the most close to natural replication of your testosterone made in your body. I've had buddies on it for 10 years, and I'm like, it promotes cancer, it does this, it does that, and you heard every negative thing, and I started to think about my conspiratorial side of my brain, and I'm like, well, everything else they told us has like been a lie, or like it's manipulated towards what they want. What's your real thoughts on TRT and who should be on it? And
so I think everybody should be on TRT. I like to explain hormone replacement, kind of like a car. I'm not the smartest guy in the world. I relate medicine to things I know. So in males, if you have low testosterone, That's like taking your car, parking in the driveway, don't start it for a year. Your car is not going to last that long. You know, things are going to go wrong, things are going to rust, things are going to break down. Same thing, low testosterone. You get low testosterone, you start to develop blood pressure, cholesterol. Low testosterone is a risk factor for prostate cancer. So your body is like a car, it starts to break down a little bit.
They say the opposite. You take it, you have high prostate cancer.
If you abuse it. Now you get to bodybuilder levels, 2,000, 2,500, stuff like that.
Yeah, not
Take your car-
750 or 1,000.
No, you know, that's taking your car, driving it 100 miles an hour every day, beating the hell out of it. That car's not gonna last. Same thing with the body, you're gonna develop all the problems. Your car is gonna last when you're driving 55, 60 down a nice smooth road. That's a testosterone level of 800 to 1,200, right in that sweet spot.
What's your sweet spot?
I used to tell people my goal for people is about 1,000. I run a little bit on the higher side just because I run multiple businesses. I'm on the go all the time, so I need a little more gas in my car. Testosterone's gas in your car. If you're starting your day with a quarter of a tank, low testosterone, guess what? You're crashing at noon because you don't have the gas to get through the day.
I'm at 1,000.
Yeah, you got a full tank and you probably get through your day.
Yep.
You're able to get through everything. So yeah, you need that optimal level to be able to function properly. The big anti-aging theory with testosterone and hormone replacement is our hormones don't change because we age. We age because our hormones change. So our bodies are brilliant and stupid at the same time. Our bodies think that we are here, our sole purpose is to pass on genetic material, to reproduce. Typically happens 20s and 30s on average. So when the testosterone levels start to decline, late 20s, early 30s, in evolutionary theory, our bodies, we've passed on our genetic material. We are no longer useful to society. So, back before the day of modern medicine, high blood pressure, diabetes, cholesterol would have killed you off, and cancer would have killed you off a lot quicker. That's certainly not the thing anymore. We are a lot useful a lot longer. So now turn the hormones back to where they are in your 20s. That 800, that 1,000, that's going to be preventive against a lot of chronic diseases. You're going to last and feel a lot better like you did when you're 20s into your 30s, 40s, 50s. When you're probably your most productive in those years because you're out of college, you're in, whether you're in your profession, you're starting businesses, that's when you really need to be on top of your game. So now take your 20-year-old energy, your body, your ability to do things, and now put that in your 30, 40, 50-year-old body, that mind. You become a dangerous person if you really put it together like that, because now you could do all these businesses. You could be a father, you could be a husband, you could get to the gym, you could keep yourself healthy, you could work a job.
It's crazy.
It's a life changing for a lot of people.
It's really crazy. It's changed my life, and I've been doing a lot the last 3 years. Like probably shrunk like 10 years of work into 5 years, and testosterone the last 2 years has been huge for me, and it's slowly changing my body composition, and I'm losing weight and putting on muscle mass, and I have bad genetics.
Testosterone plays a big key in your metabolism. How everybody says, I used to be able to hold on to muscle. I used to be able to eat whatever I want, not gain a pound. What changed? Your hormones. So now restore the hormones. You're able to kind of, have that little bit of leeway. You're able to have on the muscle, which keeps your joints healthier, decreases risk of energy.
What would be the negative side effects?
Negative side effects, I think the biggest thing we see are the increases in blood counts, which testosterone is known to increase your blood counts. So you see a lot of the bodybuilders passing away from heart failure, heart issues. The heart's a pump. It likes to pump nice, smooth fluids through it, just like any other pump. So now take your blood counts, put them up way higher than they should be. You're now trying to pump syrup or sludge through that pump. What's going to happen to the pump? It's eventually going to back up and fail. So if you don't monitor your blood counts, yes, you could have heart issues down the road.
So you should be blood testing every 3 months at least, and
blood tests every 3 to 6 months. I always tell my guys in testosterone, you're either going to go to Red Cross or you're going to come to me once a quarter, and you're going to go donate blood. I have a lot of business owners. I go, when you're paying your estimated taxes, come and do a blood dump. That's kind of your schedule that you stay on. It keeps the blood nice and thin. When your blood is at the proper level, you feel a lot better. When it's too high, you feel sluggish. You get short of breath because your body's not able to oxygenate proproperly. So you get at a good level. People feel a lot better when they're on it too. And the other big issues are really, cosmetic.
I think the other ripple effect of that is, that I've found, if you have other shit going on.
Yeah.
And you're monitoring your blood that close. And most males just don't.
Yeah.
Like, obviously females are in this hormone talk too, but for me, tough guy, excuse me, run. It's easy to be like, it's been 3 years since I had blood work.
Yeah. think of cholesterol. It's checked if you go to the doctor regularly, it's checked once a year. Maybe, once every 3 years. Where a lot can change that 3 years with cholesterol.
How intense is that blood work that you send? I know the one I have is like expensive blood work that you typically not get on the doctor.
Yeah, no, I go a lot to. So I check all the stuff your regular doc would check. So your liver, your kidneys, electrolytes, your blood counts, your iron, your cholesterol. But then I dig deep into hormones, look into your growth hormone, testosterone, estrogen, inflammatory markers, vitamins, minerals. Just correcting and optimizing vitamins, minerals, and electrolytes can make you feel the world different too. Then you put the hormones on top of it, you can really change somebody's life. But like you were saying, if you ignore these things for 3 years at a time,
it adds up.
It adds up. You could, if you know
Watch
your cholesterol is starting to creep up a little bit, you could start doing your vitamins and minerals to get it down naturally before you're being put on a life sentence of being on a statin. Once you get on a statin, you're never coming off those things. So do it naturally early and keep an eye on everything. It keeps you a lot healthier, a lot longer.
Yeah, it's a wild place. Let's take a quick break. Let's come back to this. So hopping back in, hormones are such a I think for most people, they don't pay attention to them.
Yeah, it's been ignored for forever. I mean,
what were the scales like 25, 30 years ago? Wasn't it like 1,000 for testosterone, then they kept lowering it and lowering it?
Even in the recent history, they've lowered it. Back 5-10 years ago, the diagnosis of testosterone deficiency was 350. Now you need to be below 250. What's changed besides people's hormones have progressively gotten lower and lower over time.
Why would they say that?
Instead of fixing the problem, let's just change the scale and make more people fall into the normal range.
It's so crazy, man. I mean, the pharma world has obviously so much power. I mean, look at during COVID, CNN was like Pfizer and Pfizer sponsors again, and it's fucking wild, man. So many people don't think about their health. I'm not gonna sit here and say I'm a pride of health. I enjoy bourbon and probably could do some things that make me a little bit healthier, but you can't fully ignore it. You got to pay attention. There's got to be some accountability, just like business, marriage, and everything else. You got to pay attention. How are you getting regular blood work but not testing your hormones, which are so fucking, crazy? So I want to talk about the low testosterone side effects. Rip off some of those.
Yeah, I mean, even just feeling well. So, a lot of the symptoms that we chalk up to, I'm getting older, I'm more tired, my body's aching, I wake up, I'm sore in the morning. It's not that we're getting older, it's our hormones are abandoning us and our body's not recovering as it should. It's not working as it should. It doesn't have the gas anymore to go. Like I said before, low hormones is a risk for prostate cancer, low testosterone in males. Elevated risk of blood pressure, cholesterol, heart disease, all come from having low and suboptimal hormones. A lot of hormones are protective against chronic diseases in the anti-aging world. That's why you don't see a lot of 20-year-olds, barring some genetic abnormality, who have all these chronic conditions, because the hormones protect them.
Mm-hmm. What are some other things? Yeah. I mean, there's a long list when I looked this up. It was
But, when we're talking about women, you're talking about osteoporosis, you're talking about hair changes. Women, they lose hair through menopause. Why? Hormones change. You have, the mood issues. You have higher risks of all types of cancers. Falls, risks for broken bones, changing your skin texture, your skin laxity, and you name it. Your hormones play a role. Hormones control the entire body, so they play a role in everything.
Yeah, so it's a again, I think most people should go check this stuff out, whether it's with you or some type of clinic. You should look into it.
Yeah,
it's super important. I want to talk more about how you look at the field of medicine and kind of your thought on medicine. Obviously, you're doing stuff with wellness and weight control, hormones. You're doing some other, obviously, aesthetic things as well. What would you say the biggest misconception is in health?
So I think the biggest misconception is when people get their high bills from the hospital or from the doctor, they blame it on the doctor. You don't realize that bill isn't really covering the doctor's salary. The doctor's salary, the nurse's salary, is a drop in the hat. You're covering the administrators, the executives, the CEOs who are making 7 figures. That's where a lot of that money is going. That's why hospital care is so expensive. So it's the the medication. You have to fill everyone's pocket along the way. The doctors are the lightning rod because they're the ones who are interacting. You think that's where everything is going, but at the end of the day, in the big picture of things, they're not getting a lot. I mean, you look at the cost of a bag of fluids versus what they'll charge you for in the hospital. Bag of fluids, a 1 liter bag, is going to cost $5, $6 maybe. They're charging a couple of $100s for that. It's not to support the doctor, it's to support the entire hospital salaries on that.
Mm-hmm. So when I think about medicine and what I've heard over the last, especially 4 years with COVID, is, typically doctors don't want you to actually be healthy. They're paid by the pharmacies, they're paid by big pharma. They want to get you on meds. They're in a reactive state versus a proactive state. How do you feel about that?
So I don't know what doctors are getting paid from the pharmaceutical companies because besides, a small lunch here and there, I've never gotten any money from them. They've actually put caps on how much a doctor or a practice can get from a pharmaceutical rep, and it's usually nothing more than 1 or 2 lunches a year. Back 10, 15 years ago, they used to wine and dine docs, take them to these beautiful restaurants, box seats at games, things like that, but that's certainly not the case anymore because of that misconception. But a lot of it is, doctors there's a sliding scale with Medicare and Medicaid where you get reimbursed for your preventative screening for things like that. But on the other side is, if you don't do these screenings, Medicare and Medicaid can come back anytime within 7 years and say, well, you know what, you missed this 5 years ago, we need $100,000 back and you got to pay that back. So doctors now overcompensate and do more than they have to try to make sure that they're not going to come back and lose that money down the road. And then it's also fighting with insurance. Insurances don't want to cover and pay for preventative medicine. A lot of people, if you have an elevated lab, the HSCRP, which is an inflammatory marker that we could use to risk stratify cardiac events. If you go see a cardiologist, they're going to recommend a calcium score. Calcium score is a wellness test. No insurance covers it. It's out of pocket because it's considered preventative medicine. So insurances pay for people to be sick, so it's easier to get covered and reimbursed for sickness rather than a well visit.
Yeah, it's fucked up. It's ass backwards.
It is.
It really is. And it's frustrating when you're raising a family, you have a business, you're paying for health insurance, and then you're going, what is my health insurance? I mean, I have a $7,000 deductible.
Yeah.
I'm a business owner. I clear through X amount of, corporations, and they provide me decent health insurance, but it's not super special. And you think you're getting your annual checkups, you're doing all the right things, you're going to the doctor when you don't feel good. Mm-hmm. It's obviously problematic, and our stats show that in America, all diseases, heart.
Yeah, absolutely. And
death.
Then people also lose trust in doctors because a doctor has to see so many people an hour just to support the overhead. And a lot of these smaller private-owned practices are being bought up by the large hospital systems to make them more efficient. So a lot of people don't feel like they're getting good care, and honestly, they're probably not because it's a 5-minute visit. Here's your scripts. See you next time. They never explain to you what's going on with your blood work, what's going on with your body, why your body's doing certain things. Because honestly, they just don't have the time because they have a quota to meet to reach their overhead.
Do you think that ever changes in traditional healthcare? Can it?
At this point, I don't think so. I mean, unless we're going to cut out a lot of the corporate aspect of medicine. No, because the corporate aspect of it is what makes it so expensive and makes it that you have to meet these numbers. If it was just traditional healthcare where it's a doctor-owned practice, doctors back to 20, 30 years ago.
That's becoming seldom. Like even the guys that are good in orthopedic surgeon or cardiac. I had a buddy created a software that I was involved with originally. It was called. It was like ZocDoc. It was called Radius Care, Radius Inc. And the thought process was, if you have a disease, check the radius that you could travel. It will cure that disease. It will give you doctor's information, all this stuff. And they're pulling down medical info from certain silos of the government. Why is medical info siloed to begin with? Like, why wouldn't it be open information? So if I had something and I come to you as a doc, why can't you throw it into your AI or your computer to be like, this, and that, but you're not maybe privy to that information? Like, that's fucked up.
It is. It's a lot of, we keep your information here, this information's here. There's no intermixing. a lot of the medical
And they
record
lie through
systems-
HIPAA. That's how they get away with that too, by the way.
Yeah, it's all protected.
Yeah.
They're trying to combine where you get access from in between systems, in between this, in between that, but then your information is out there in the medical cloud that was exposed. So
what's changing healthcare, right? So let's talk about like food, right? You see, MAHA, Make America Healthy Again, right? Robert F. Kennedy, ex-addict, got into fisheries, sued them, all about health, wellness, natural. Food dyes, right? My wife is one of the moms on Instagram checking all of the different stuff out to make sure they're keeping their kids healthy. Like, what are the major things beating up testosterone, beating up our bodies? Obviously, the traditional things, alcohol, cigarettes, eating Burger King.
Yeah.
But what are the other things that a lot of people just don't think about and we don't really have control over from a regulatory standpoint?
yeah, it's obesity. It's eating, the processed foods are terrible for you. If you look at, you could go over to Europe and you could eat pasta every single day and you'll probably come back and you'll probably lose weight just eating over there because you're eating clean food. You're not eating the processed, the preservatives and everything. So clean, healthy,
What is
fresh-made food.
preservatives? Like, I've never dove into that.
Preservatives are things that are added to food to extend the shelf life.
I get that, but like, what is it? Like, what is the actual science?
Yeah, I'm not sure of the science behind it, but it's essentially chemicals. You see, look at the list of ingredients in foods. It's not simple things. There's 20 different things. A lot of it is just preservatives, things you use to keep things fresh.
And as a doctor, like, have you never challenged that of like, Europe, you could eat pasta all day, drink wine, and they're all fucking thin over there
Yeah.
with, a half the problems that Americans have. Like, what's going on here?
Yeah, they value making a home-cooked meal and sitting down and having fresh food, where us, it's, let's grab on the go and eat what we can when we can and, feed the kids, get them to the sports, get them to bed. We are go. So our food has now adapted to that. Way back when you could support a household on a single income and, the wife could stay home, take care of the kids and have everything, people were typically healthier because there was fresh food being made. Things were cooked. It wasn't, microwave meals. It wasn't fast food, things like that.
Yeah, it's hard to get good food unless you're shopping at a quality butcher or you're really reading those ingredients. I mean, my wife is a hawk with it, and she still struggles, right? Peanut butter, just stupid shit you don't think about that has this is not, and it has this like science code almost you can't read, like a cyber code.
Yeah.
It's like, well, what's in this? Like, what does it really do to my body?
Yeah, exactly. Well, the dyes, all the food color. I mean, you go over to Europe and foods that we have here look different. The colors are different.
Doritos
have
even.
it added. Yeah. Look at the Fruit Loops. The Fruit Loops are almost, kind of pale in color over in Europe, and because they don't have the food dyes and everything that we have in here that make it bright and colorful.
It's so bad. I hope it continues to change. I hope Robert F. Kennedy, they just announced this new Surgeon General. What's her name?
I just announced it today. I can't remember her name, though.
Yeah. She's been big on social. And Casey. I think her last name is Casey. I'm excited for it. I mean, I try to be healthy. I'm not the healthiest of guy, but I want my kids to be healthy. I want them to have a fair shot, like not be at a disadvantage of bad food and society.
I mean, we are at the highest rate of obesity and the most healthy that we have ever been as Americans.
Wait,
The way I
highest
look
rate
at
of obesity and most healthy?
No, obesity and least healthy.
At least healthy, yeah.
The way I look at it is it can't get any worse.
Yeah.
We can only get better from here.
What's the biggest thing people are coming into you to see in your place?
It's a mix. It's a combination of hormones and weight loss or weight management. Obesity puts you at risk for all those chronic diseases. So getting your weight under control, yes, there's an aesthetic aspect to it, but it's also getting people healthier. I have people who come in, they want to lose weight because they want to feel better, but they don't realize, they're getting off their blood pressure medication. They are fitting into different clothes. They're able to, I had a woman the other day who had lost 40 pounds with me, and she goes, I was able to get on the floor with my grandkid for the first time in 3 years and get up and not have to have help getting up. She was in tears because of that. It's those things that you don't realize. It's like, oh, I'm getting bigger, whatever. I'll diet, I'll exercise. Never happens. And then you just kind of fall deeper into that
What are you
hole.
doing to help them most to lose weight?
So I always tell people, there's no one answer for it. Yes, the weight loss meds, they help. But the way I do it, they're used as a crutch. I tell people there's 3 aspects to weight loss. It's your diet, your exercise, and then hormones, including the GLPs and the testosterone all being part of the hormones. If one of those pieces of the triangle isn't working, that triangle falls apart. A lot of people, as you gain weight, you have more insulin resistance. True heavy insulin resistance is when you're a diabetic, but you could have some portion of insulin resistance without diabetes. I always explain insulin resistance. Insulin resistance is, it causes more insulin for your body to do things. So if you take a room, that room is your cell. Insulin is the hormone that allows your cells to take up sugar, nutrients, everything in the bloodstream, to use it as energy as building blocks, because things that are left in the bloodstream circulating typically get stored as fat. So I tell people, insulin is going to be like having $100 in your hand. You have that amount of insulin that your body makes. You have a bunch of stuff in the hallway you need to get into the room, and there's a doorman in it. That doorman is your insulin receptor. So normally without insulin resistance, you give that doorman that $100, you're able to get everything into the room that you need. There's nothing left in the bloodstream. You're not storing fat. So now you have a little bit of insulin resistance. So come to the door, you still have that $100 because that's all the insulin that your body can make. The doorman, the insulin receptor says, well, now it's $120 to get everything into the room. Well, I have 100. Okay, well, you get whatever you can into the room. That other stuff circulates, gets stored as fat. As you develop more fat, you have more insulin resistance. So now it's 130, it's 140. So the whole diet exercise thing is great, but you're still missing that aspect where you still need to get down that insulin resistance. You need to get the hormones working to be able to
What's the best thing to
beat
get it down? I know you've talked about Wegovy and Ozempic.
Yeah, it's not only that, it's the testosterone, because testosterone will allow your body to have more demand. You have more demand for calories in your muscles. You're going to have a little more insulin production, so you're going to be able to get more things into the cells.
Do you have calorie demand because you're actually doing more, because you're motivated to more? Or is it?
It's a combination of everything. You're able to do more, you're motivated to do more, and your body is now able to burn more calories off, so you're burning everything off. So you optimize all 3. And I always tell people, it's not diet, it's lifestyle changes. You go on a diet, you could lose 20 pounds, but guess what?
Diets suck
because
because
diet, it comes back.
you got to be honest with yourself. I mean, I'm always honest with myself.
Yeah.
Like, I'm going to have cocktails, once, twice a week. I'm going to, snack on this or that here and there. I'm not going to be a fucking bodybuilder. So what are the changes I can make to just cut down my calories, stay in the gym, and continue to burn more fat than I'm fucking putting on?
Yeah, I always tell people, when you're dieting, regardless if you're doing weight loss meds, testosterone, whatever it is, you want to focus on your protein. If you're getting like a half a gram to a gram protein per pound of your goal weight, your body's going to have enough. Otherwise, your body will start breaking down muscle, start to lose muscle, your metabolism starts to slow down.
It's hard to eat that much protein.
It is.
I'm 260, man. 260 grams of protein is a lot of protein a day.
Yeah, throw a protein shake or 2 in there. That's 60 grams. That gets you part of it too. You do need carbohydrates for your body to function. Your body can't function without carbs, but you want to pay attention to foods that are low in the glycemic index, foods that won't blow your blood sugar out of the water, which once again, lower blood sugar. You're able to get more of that sugar into the cells and not have it stored as fat, so it decreases the insulin resistance. You need a little bit of fat, but you want to be moderate on your fat.
Which
so
is where
balancing
Ozempic
everything.
comes into it.
Exactly.
It obviously just drives down that desire to eat.
Drives down the desire to eat.
It's more of like a mental thing it does to you.
It is. It does a great job. I mean, it does work in the brain. It does help with addictions. Whether we like to admit it or not, food addiction. We're all addicted to foods. We get together with friends. What are we doing for dinner?
Yeah, it's just
You come home from work. Oh, what's for dinner? We're planning around food. So you kind of break that addiction, and life becomes a little bit easier. But yeah, it makes you kind of break that. But then your body's able to also process things a little more efficiently, so you're able to use.
Let's
the
challenge
nutrients you use.
Ozempic though. You hear, it shrinks your heart. It fucks your eyes. It's this. For me personally, I really believe in 5 more years, you have major lawsuits out about it.
Yeah. And, it's because of our American culture where let's do everything to the max. You don't need to max out. Microdosing is better because you still want to leave yourself with an appetite because you want to make sure you're able to get your proteins, you're getting your nutrients in. You don't want rapid weight loss because that's when your body starts to lose muscle. You can lose muscle extremely fast. And muscle is what's going to keep the fat away. So, of course, people stop the medication. They've lost a ton of muscle. What comes back? Fat. They gain it all back. So it's all about doing things in smaller doses in moderation.
Yeah, because you see a lot of people that get on Ozempic, man, and all of a sudden they're it's like a chick, who's...
They waste away.
Yeah, they waste
away.
Yeah, they look like they have cancer.
Yeah, because the body, cancer, it will eat away at your muscle. Ozempic at too high of a dose, you don't eat. Your body's going to eat away at its muscle. So
do you really fully believe that's safe?
at low doses, yes. So the way that some people do, where they go to the max dose, yes. I try to not get my patients on. I try to tell my patients, I'm going to find the lowest possible dose that controls your appetite. You're going to lose, on average, 1 to 2 pounds a week. Nice slow loss. Your body's going to be able to adapt to that. And you're also going to take the time, and you're going to learn new habits, new eating habits. You're going to start to lose weight. You're going to have less pressure on your knees. You're going to be able to be more active. So I do it as a slow learning process where the weight loss medications are a crutch to learn these new habits. They're not the answer to lose weight.
Yeah. It's a help.
Absolutely.
It's guidance.
Yeah. It's your crutch to get to where you need to be to get strong enough to do it on your own.
We've been talking a lot about wellness.
Yeah.
This is good. That was good though, right? Helpful, even for me, and I'm sure people to watch. But you're an entrepreneur, man. You do a lot more than just being a doctor.
Yep.
Let's talk about your other business. Let's talk about the gym to begin with.
Yeah.
Kind of the AI gym. That's super cool, unique.
Yeah. So I have a new gym opening, another local place, but I've had access to this fitness equipment where it's adaptive resistance. So it changes the resistance on you basically every second. So if you're here doing a bench press, you're pushing with 100 pounds, the machine's giving you 99 pounds back. You're up here giving 120 pounds of force, it's giving you 119 back. But it's making you push to that true failure of your muscle. Your muscle's under constant 100% exertion the entire time through. So it depletes, it drains your muscles. And they've done studies on the devices. Doing a 20-minute workout once a week is like doing 3 to 4 hours in the gym with traditional weight training and cardio. You get better cardio effects, the heart is healthier, you're getting fat burning, you're getting muscle building, all the things that you need in a quick session.
How often, when did these machines come out?
The machines have been out a couple of years now, but the technology is still new, but it's all with the AI stuff where it also is something nice because you now gamify it because you do bench press 1 week, well, guess what? We see all your curves of how much force you put out. So next week, I want you to beat what you did last time. So you're able to see, okay, my force are here, I'm going up. So you see your progression, you see the body changing. I mean, I know for me, when I tested the machines, the selling point for me was when I did a bicep curl, I went to pick up my phone afterwards. I didn't have the physical strength to pick up my phone. I was that depleted. I remember I was doing my last rep of shoulder press and my partner saw me to push. I'm sitting here I had no energy to even push the little handles up to get any type of motion. So it's a true different type of workout that your body just responds differently to.
How's your gym going to work? How does somebody sign up?
So we're going to be opening in the next 2 to 3 weeks. It's going to be one-on-one or two-on-one with a personal trainer. So making sure that you're doing things safely, you're doing things properly. You'll be there. If you're walking through your workout, you'll be in and out in 20 minutes. The other nice thing is too, we threw a cold plunge and an IR sauna in there, so you can come and do some of the recovery stuff also. But you're going to see results. You're going to feel better. You're going to get those other two aspects. That exercise portion of it, you're going to be able to get that into a busy time frame.
How often should they come a week?
You could come in once a week and you'll see better results than probably what you're doing at the gym because you're not pushing yourself to your max at the gym. How many times you go into the gym, you see a personal trainer giving a woman the 5-pound pink dumbbells. They're not doing anything. They're not stressing anything. Mm-hmm. So now you're getting what you're putting in and you're actually getting results. The other thing is it's safer because your form is controlled, but you're also you're not overdoing with the weight. How many times you pack 45s on and you're struggling, you need somebody to pick it up off your chest. Mm-hmm. That's not happening anymore. So you're not hurting your joints because you're doing what your body can take. So you're not overexerting yourself.
What's it cost? What's the cost of that?
It all depends on the membership. We have memberships where you get to come in, you get to do the gym, you get to do the IR sauna a couple of times a week. That's going to run you about $350, $400 a month. You could come in, just use the fitness equipment for under $200 a month. You could come in daily sessions, just drop in to use the sauna or use the cold plunge. So you have all different options for everyone. You could just do session by session. So we've tried to make it that it's something for everyone can use.
Let's go on. Where are you located?
It's going to be in Manalapan. We're on Route 9. We're about, if you know where Cascator is, we're about a quarter mile south of that. It's called New Lift Fitness, NULIFT.
That's awesome.
Yeah.
That's a really, I've never heard of that.
Yeah, it's something nice because it fits into our American lifestyle where we want quick, fast results and we don't want to spend a lot of time doing it. So, if you work in the city, you don't have time to get and spend 3 hours at the gym, but you could probably find 20 minutes in your week to get into the gym and do that quick training session.
I hope you can.
I hope so.
20 minutes, not that bad.
That's everybody's
I
complaint. I don't have the time to go to the gym. I don't have the time. I wish I had the time. Mm-hmm. Well, now we've eliminated that complaint, so got to find something to do to
No
complain
more
about.
excuses.
Yeah, exactly.
What else are you doing, man? I mean, your mind moves. You're a guy we were talking earlier, like, hey, I have friends with some money laying around. They don't want to do traditional stock market stuff. Like,
Yeah, so one of my other big ventures is we've talked about how important hormones are. I'm launching a hormone replacement franchise. It's called Rinia HRT, where it's just going to focus on hormones. You've seen Game Day, you've seen these other franchises pop up. The big aspect is we want to make sure we're doing right by the patients and make sure people are well taken care of. So we've put my whole theory of medicine and taking care of people into a franchise model now, where you can multiply it and take care of people and do right by people. But hormones is a huge market where people are investing in hormones as a patient, but also on the business side, because it's such a lucrative business.
yeah, it's blowing up for sure.
Yeah.
And where's that based out of?
So we're based actually out of Pittsburgh, but being a franchise, you could open one wherever you want. We're looking to open one actually probably in Homedale. We're opening one in Philly. We got one opening in Georgia, Washington State. So we're gonna be nationwide very soon.
What's the cost?
So it all depends. I mean, the franchise fee all in to open one, you're probably looking somewhere between $200 to $300, depending on what you want to do for your build out. And,
That's the franchise fee?
No, that's
the all-in cost.
That's franchise fee.
Yeah.
That's your training. That's your build
What's the
out.
fee? What's the
estimate.
franchise fee?
Franchise fee is about $35,000.
Yeah.
So we've tried to make it reasonable, and we are setting up a social network just for our franchisees where you can bounce questions off of other providers, other practices. Hey, I had somebody come in with this side effect. Anybody else experience that? So the other big thing is you're not left on your own. You have a franchise and you see a corporate once a year, twice a year. You have access to an entire network where you have support. You have people who can answer your questions.
That's fucking great. And you can access that in Jersey soon?
Yeah, we're going to be licensed to open in every state very soon.
We got to get an announcement going.
Absolutely.
Dude, this has been a good conversation.
I appreciate you having me.
I like to ask two questions at the end.
Please.
First question is, if you could tell a young entrepreneur anything, what would it be?
You got to find something you love and realize it's going to suck in the beginning. I remember there were days where, I'm wondering, how am I paying my bills? How am I putting food on the table? And, you got to bite the bullet, because you got to get through the tough times to get to the good times. It's not going to be perfect at the beginning. So it's just having that grit and that drive to see the bigger picture and get through the tough times.
Yeah, it's all about the grit, man. Second question, anybody you want to give love to? Obviously, you talked about your parents and...
My parents have been huge supporters. My fiance is the one who's, pushing me now. But I'll tell you, my 6-year-old daughter, she's my drive to do everything.
Of course.
I got out of the hospital because I wanted to do better for her. I wanted to give her a better life. And, part of the benefits of being an entrepreneur is I get to dictate my schedule. So, I get to be the class dad. I get to be there for her games. So she's been my biggest drive in all of this.
Yeah, that's so true, man. How can people find you?
I'm on Instagram. My Instagram, it's at dr.mike_do. My office here in Tinton Falls is keepglowingmedicalspa.com. The gym is newliftfitness.com. You can find me all over there.
Yeah. Or if you want to get in touch, shoot me a DM and I'll connect on his cell phone. Dr. Mike, this is awesome, man. Thank you.
I appreciate it.
Super knowledgeable, really. A lot of help.